wanted to give you your discharge papers before you go home and ask you if you have any questions or concerns about your diagnosis.
Well, yeah, I do. I came in today and the doctor told me that I have something wrong with my heart, but I don't really understand. I feel fine, and he told me I need to take all these medications every day, but I don't really understand why.
Okay, well that's why we're here, to help explain it to you. So the diagnosis that the doctor did give you is atrial fibrillation, which means you have an irregular heartbeat that can lead to blood clots and stroke or heart failure and other heart-related complications. And some people refer to atrial fibrillation as a quivering heart. So to give you a better picture of this, I can show you a little animation here. Here is a picture of the heart, and this shows the conduction system of the heart, which makes your heart contract. See if it'll go to the next page.
Oh,
so,
yeah, there's a heart beating.
There's a normal heart beating. It's contracting and sending blood to all your body. But with an atrial fibrillation, you have these random impulses firing that's making your heart quiver randomly. So your heart isn't contracting as it should in regular patterns to send the blood to the rest of your body.
Okay.
And so that's why you've been having some of the symptoms that you came in for. You had general fatigue, that thumping in your chest, that's the rapid irregular heartbeat. You came in with dizziness and shortness of breath, weakness, faintness, or confusion. Fatigue when exercising.
Yeah, I've been feeling that for a while.
Yeah, so those are some of the symptoms you can have with atrial fibrillation. Sometimes you may not have any symptoms at all, so it just kind of depends. A lot of times this can happen for unknown reasons. It can be congenital, or it can come from advancing age, heart disease, prior heart attack or heart failure, high blood pressure or diabetes, excessive alcohol drinking or smoking. These are all risk factors that can cause atrial fibrillation.
So that's how I got it then, huh?
Yeah, that's how it can happen. So I do want to help you to remember some of your signs and symptoms that you'll have normally with this.
Okay.
But I also want to let you know some of the signs and symptoms you may have that could indicate a stroke or a heart attack, because you are at a higher risk for that now.
Oh, okay.
Because of atrial fibrillation. What happens is, because the heart's quivering, the blood is pooling into the atria. And when that happens, a clot can form, and that clot can be dislodged and sent somewhere else in your body, like in your neck going up to your brain. That can cause a stroke, or near your heart, it can clog an artery and cause a heart attack.
Okay.
So we do want to help you to be aware of those signs that you should call 911 right away. So if you have any chest pain, that is a sign that you need to call 911 right away.
Okay.
So you should also know some of the signs of stroke. I know this is a lot of information right now, but we'll give you some flyers to take home too, so you can remember. But signs of stroke could be facial drooping, pain in your arm, and trouble speaking, like slurring. Okay. So you need to call 911 if that happens.
All right.
And then signs of stroke, heart attack are pain in one or both arms, traveling up your neck into your jaw, stomach pain or back pain. Those are all and chest pain, of course, signs of heart attack. Okay. So make sure you do call 911 if any of that happens. Okay. And I will give you a handout to take home if you have any questions. This can answer some of those. This tells you about atrial fibrillation, what it is, and these are some of the information for stroke.
Okay, I'll give these to my wife. We can look it over when we get home.
Okay, sounds good.
All right.
Okay, so the next thing we want to talk to you about is your activity level. Because that's a really important part with atrial fibrillation, is knowing what you can and can't do now. And we don't want to limit, we're not limiting, the things you can do in your normal life too much, but just certain things. So what is your normal activity level? What do you do on a daily basis?
Well, I don't exercise a whole lot, but I do like to take the dog for a little walk every morning.
Okay.
I do most of the work around the house because my wife, she doesn't get around so well. So, you know, if there's any yard work or carrying stuff up the stairs or getting ready to clean all these leaves off the roof because they're just coming down like crazy.
Yeah.
So I do all the yard work, I clean up the yard, I clean the roof, I do stuff like that. I'm gonna get up on my roof this weekend and clean the leaves out of the gutters.
Okay. So it sounds like you actually are pretty physically active.
I guess so.
Not necessarily working out at a gym, but you're doing a lot of hard work around your house. So the main thing that we want to say with atrial fibrillation is we're not trying to do any extra physical activity that you've never done before.
Okay.
We want to maintain the physical activity that you had in the past, and then just make sure that that's safe.
Okay.
So I heard you say you like to walk your dog.
Yep.
That's a great activity to do. And when you're doing that, before you walk your dog, you can monitor your pulse to get your heart rate and see where you're at, what your resting heart rate is. That's something that is
How do I
important
do
to
that?
So you can do that by taking either hand, if you're left or right-handed, and just go from the thumb and kind of go upwards on the wrist here.
Okay.
And you're just gonna feel for that pulsing. Can you feel that?
Oh, yeah.
Yeah. So you're gonna count the pulsation for 1 full minute,
Okay.
and that's gonna be your resting heart rate. So if that starts shooting up, you know that you probably need to cool down a little bit if you're jogging or something and you start walking. And that's something important to monitor. I would say a lot of people have those Fitbits now, or you know, something that monitors their heart rate. You could always get something like that. So I have one of those and I love it. But another thing I want to say is I heard you talking about getting up on your roof.
Yep.
And doing a lot of physical activity on the roof.
Well, I gotta clean off the roof. You know,
Yeah.
It's gonna rain.
I know. So I know that's important to do, but it is, I'm a little bit worried because with atrial fibrillation, think about the symptoms you came in with today. You were fatigued, you were dizzy. If that happened on your roof, that could be really, really unsafe. And it would be pretty bad if you fell off your roof or something like that. So I want to make sure that you're doing activities that are safe and within the limits for you now.
Okay. Well,
Okay?
Because another thing, you are on anticoagulant medication.
is that the medication the doctor gave me?
Yeah, to prevent the blood clotting.
Okay.
So another thing to keep in mind, each time you get a little cut or scrape, or if you were to fall, you know, like off your roof, you could have internal bleeding.
Oh.
The risk is that you won't clot as well, and you could hemorrhage, which can be really dangerous.
Yeah, that sounds bad.
Yes, so it's important to, you know, just watch your activities, practice safety. I would get a medic alert bracelet.
Is that
You
one
know
of those
what
things
that
people
is?
wear all the time?
Yeah, it will let health professionals know that you are on anticoagulants. And I would suggest, I mean, do you have anyone that can help you with the leaves or getting up on your roof?
Well, my
or-
son doesn't live too far away, but I don't really want to ask him to do all my work for me. He's got, you know, a job and kids, and he's busy, and I feel like I can rake my leaves and do stuff like that, so.
Well, I would at least let people know where you are. If you're in the backyard or, you know,
Okay.
make sure your wife knows, I would not get up on the roof.
Okay.
It is the time, it's time to ask for help. It's okay to do that with your condition.
Okay.
Because it can be pretty risky.
Yeah, I don't want to fall off my roof.
No. So we just want to make sure that you understand the key points that we've gone over today.
Okay.
So just as far as a healthy activity, what would you say would be something good you could do?
Well, you said walking my dog is a good
Yes.
idea.
Yes.
And I can still rake the leaves, I just have to let people know what I'm doing, and I should not get on my roof. I don't know who I'm gonna call, I'm gonna have to find somebody to call when I get home to clean out those gutters. And I need to monitor my heart rate too, because it can't get high, so.
Yeah, and can you tell me some of those signs that you should look for to call 911 if you have any
Well,
of them?
heart attack and stroke you said I could have. So heart attack signs, I'm gonna have chest pain or arm pain that can go to my neck or
Yeah.
stomach. And I don't want chest pain. And also you said something about confusion. Oh, fast, that's right. So if my face
Drooping?
droops,
Yeah.
if I slur,
Yeah,
I need to call 911.
good,
Yeah.
good.
Mm-hmm.
That's good for you to remember.
Okay.
So if you have any other questions that come up after you go home,
Mm-hmm.
feel free to
much.
Thank you, Bob.
Thank you.